Our hospital has received some much-needed funding from the provincial government for two very important programs: the screening of high-risk breast cancer patients and the Mississauga Academy of Medicine, or MAM, a partnership between the University of Toronto, Trillium Health Centre, and the Credit Valley Hospital.
Today, I'm very pleased to announce that approval has been provided here at Credit Valley Hospital for, number one, renovations to existing space to accommodate the increased volume of medical trainees for the 2011-12 academic year. So really what we're doing here is providing adequate space so that it could provide a good learning environment to house the new medical trainees. So I really want to thank the Credit Valley Hospital. I want to thank the Trillium Hospital, the UTM, and also our LIN partner here as well for help us to make this academy happen. I think this is the right step, and this is the greatest thing that we could do in the city of Mississauga.
On behalf of the University of Toronto, University of Toronto's Faculty of Medicine and University of Toronto Mississauga campus, I just want to express my gratitude to the Government of Ontario, and specifically to our Minister Takhar, who has been just a wonderful messenger for this great news that you have brought to our community today. This whole project is about collaborations and partnerships. It is a partnership that started between the Faculty of Medicine at downtown campus of University of Toronto and the University of Toronto Mississauga, then expanded to the two local hospitals, the Trillium Healthcare Centre as well as the Credit Valley Hospital, and the partnership with our Ontario government, who have been just tremendous in their support for this project.
I'd like to give credit to the province of Ontario for recognizing the need for additional placements and training for medical physicians in this province to support those areas which are underserviced and replace the doctors who are retiring in the next 10 years. I'd also like to thank specifically today the Ministry of Health for this grant, which is going to help us build the Phase 8 facilities at the two hospitals, which are going to help us provide the clinical learning spaces necessary to provide that quality training program for the students that are going to do their places at the two hospitals. So thank you very much.
We're gathered this afternoon for a special announcement from the provincial government regarding funding for high-risk breast cancer screening here at Credit Valley.
Starting July the 1st, Western Mississauga women at high risk for breast cancer will have access to services at the Ontario Breast Screening Program High Risk Screening Centre here at Credit Valley Hospital. Women who think they may be at high risk can visit their doctor or nurse practitioner for a referral to the Ontario Breast Screening Program. Credit Valley Hospital is one of the first 19 high-risk screening centres in the province. Regular screening, combined with greater self-awareness and improvements in treatment, have been shown to save lives. In fact, deaths from breast cancer have been reduced by up to 1/3. This is one way in which our province has made sure that we extend the best in healthcare to all the rest of us. Thank you very much.
We know that early detection is key to improving the outcomes of women with breast cancer. Simply put, increased screening leads to increasing survival. With this additional funding, more women who are at high risk for developing breast cancer will receive access to genetic testing and to counseling, as well as to annual mammographic screening and breast MRI. I think it's fair to say that in this audience and in this community, we all know someone who has been touched by breast cancer. This year alone in Canada, more than 23,000 women will develop breast cancer, and at the present time, more than 5,000 will die of this terrible illness. Ensuring greater participation by women in screening, along with gaining access to vital resources, as announced today, gives us an opportunity to change these sobering statistics in a positive way. And so once again, I want to thank the Ontario government for this important investment. I'm convinced you'll make a difference now and in the future. Thank you.